They say that health is wealth. You never know what God has done for you if you are healthy in Nigeria. Welcome to the Diary of a Broken Man, where we dissect political, economic and social issues in Nigeria. Good morning, good afternoon, good evening, depending on where you are watching me from. You are welcome. Feel free to join in this discussion in the comment section. Remember to subscribe, to share, and to like as usual. Today we talk about healthcare system in Nigeria and the several significant challenges we face in Nigeria. The healthcare system in Nigeria, faces significant challenges which can be broken down into two separate parts. Doctor-patient relationship and the impact of medical tourism. Then later in the video we talk about the National Health Insurance Scheme and how they fare and why it is necessary to have health insurance as a Nigerian. Doctor-patient ratio. The current situation. Nigeria's doctor-patient ratio is notably higher than the World Health Organization WHO recommended. WHO recommended one patient to 600 one doctor to 600 patients per interval. Unfortunately, Nigeria has one doctor to 5,000 or even to 10,000 as the current research is showing. So you can imagine that a single doctor will be seeing 5,000 people, 10,000 people. You can imagine the workload and how he will be doing it, because he has to see other people. He cannot remain in one person. So the possibility of him or her listening to your going through your needs may not be there, because there's no time. He has to see other people. So Nigerian ratio is approximately 1 to 5,000. The disparity is due in part to brain drain. We shall talk about brain drain phenomena later in the video. How our best minds are running out of Nigeria and going to a significant number of our doctors. What are they looking for? They are going to a place where better professional opportunities are and the better working conditions are. If you are not appreciated where you are, you go to where you are appreciated. Simple. So we've seen that situation and it's appalling. What is the implication of this brain drain and this 1 to 5,000 ratio? What is the implication? This high ratio leads to overburdened healthcare professionals. Longer waiting times. You go to see a doctor, you spend days, months. You may get an appointment for next 2 months, where you need urgent attention. So, and then potential lower quality of care due to stretched resources and workforce. The shortage of doctors also affects the availability of specialized care, especially in rural areas, which creates healthcare disparities across the countries. The impact of medical tourism, that's another thing we'll talk about. Medical tourism. Now, economic and the health system impact sees a substantial amount of medical tourism in Nigeria, with an annual expenditure exceeding $1 billion. According to web sources, the primary drivers include inadequate health infrastructure, lack of trust in the local health system for complex procedures, and economic disparities that make treatment abroad even more feasible for those who can afford it. Now, have you been to a general hospital in Nigeria, especially the ones in the villages? Before, I think it was when I wanted to leave Nigeria. Was it 2022 or so? I had to take the COVID-19 and the yellow fever shots and then get the certifications. So somehow, something in me told me to visit the wards, see where I can help a few people in the wards. And I think it was in the orthopedic section or the pregnant women section. I don't remember, but I remember I went to two sections that day, and together with the group that I came with, and we went there. I couldn't imagine how people were comfortable in those hospitals, even though they were already, that hospital was regarded as one of the best hospitals around. Yet our politicians travel around the world for healthcare. They move to India, they move to this, they fly, the language you fly him to. How about the common citizens, the average individual in Nigeria? Can they afford to fly to India or to UK for healthcare? When a sitting president of Nigeria, we saw Buhari, the former president, jetting around the world for healthcare because he has nothing in his country to write home about. That is why I still believe that the most shameless set of politicians are the ones from Africa. They have no shame at all. They have no shame, because to build and run hospitals, some of them can, out of the comfort of the monies they have stolen, can build wonderful hospitals, but they can never do that. Schools, they can never do that. Instead, the road, they can never do that. These basic amenities, rather they will jet to another country, go to another country, and they pay them, use the money they should be using to, make it right in Nigeria. Until we make it a must that any sitting political officer should never go out of Nigeria for healthcare or allow his children, go to another country to study. Until we make it a must, Nigeria is going nowhere. The reason everything is like this is because they still have the rights to, and the opportunity to travel out of Nigeria. If we make it a must that they must remain here, you see the hospitals get well. You see our doctors being paid well and our nurses being paid well, or treated well at least. The consequences. On one hand, medical tourism drains potential revenue from the Nigerian health sector and reflects poorly on local healthcare capabilities. On the other hand, it highlights the need for systemic improvements in healthcare deliveries. This outflow not only affects the economy but also deprives the local population of the potential benefits of advanced medical treatments and technologies, which are often sought abroad. Let's talk about National Health Insurance Scheme, NHIS, which was established in 2005. However, its effectiveness in achieving universal health coverage is limited. Only about 5% of Nigerians are enrolled, leaving 95%, majority of the population, to finance their health out of their pocket. The low coverage rate is attributed to various factors, including poor implementation, corruption, and inadequate health infrastructure. What are the challenges NHIS face? Struggle with issues like insufficient funding, low public awareness, and high cost of premiums relative to the incomes of the average Nigerian, particularly those in informal sectors. There is also a noted inefficiency in service delivery. Let me not talk about public health offices in Nigeria and their laissez-faire attitude, the way they treat Nigerians, as if, in fact, every other person in any office, even if it is a local government office, sees themselves as gods. For you to enter their office, you need to sort this person, meet this person, call this person. So there is noted inefficiency in service delivery, with challenges in reimbursement and quality of care, which discourages further enrollment. How will I register when taking the money becomes a problem? Improvement efforts. Recent legislative changes like the National Health Insurance Authority Bill passed in 2022 aim to expand coverage, especially for the poor and the vulnerable, by making health insurance more accessible and mandatory. However, the success of these measures will depend on effective implementation and increased funding and overcoming systemic corruption. Because when we say these things, we talk about corruption too. People squander money from behind. They write money with pen Today we saw issues of Islamic and I think it was Board of Islamic and Arabic studies about Arabic education, that we are signing 8 billion per year, 8 billion per year to organize an exam, organize exams. Everybody, somebody sang a song and said everybody is a criminal, everybody is a criminal in Nigeria, and it's true. Every single office is trying to steal money. Any single opportunity to serve the country, stealing money. And not just, when they say steal money, they are not even stealing in millions, in billions and trillions. And you look at their lives, you don't even see this money in them. They still look tattered and they look weak, look sickly, even with the whole money they are stealing. So, in summary, Nigeria's healthcare system is grappling with a severe shortage of medical professionals, an exodus of patients seeking treatment abroad, and a health insurance scheme that, while well-intentioned, has yet to effectively meet the needs of its vast population. Significant reforms in policy, funding, and the healthcare infrastructure are crucial to address these issues. How will they fund and refurbish our hospitals when they are interested in stealing? When their interest is in the next country to go for health tourism? You know, people go to do checkups in UK because they have government funds in their pocket or in their hands. Nigeria, the kind of extractive institution that we run in Nigeria, where a few elites control everything and they do everything as if the national treasury is their public purse, is their personal purses. They travel to the best of places, eat the best of food, stay in the best of hotels. In fact, if you know the kind of hotels, the kind of kingly treatment your politicians receive or pay for, because they pay for these things, you wouldn't be saying that Nigeria is poor. We need to take our political class more seriously. These people are wrecking Nigeria. They are wrecking us to the ground. And everybody is sitting complacent. Now, I think our problem in Nigeria is this over-complacency and the docility. We watch it happen and we move on. One person steals 80 billion and EFCC could not arrest him. And it's swept under the carpet. Till today, nobody spoke about it again. One other person scammed the whole country of Air Nigeria, Nigerian Airways. Nobody spoke about it again. One other person stole heaven and earth, and nobody is hearing about it again. It's still just the same story. Until these people are taken into account, nothing will happen. Look at our healthcare. Go to our hospitals, especially those ones in the villages. Looks like poultry. Looks like poultry. I think it was a Aproko doctor who visited a general hospital. I think it was not just general hospital. I think it was a maternity home, and they saw the dilapidated and deplorable state of the place. And
this is where women give birth. That's the toilet. This is where people give birth. In this primary healthcare center, this is the only forceps in this entire place. They don't have more than this. When women come at night to give birth and there's no light in the hospital, how do you take their deliveries?
Well, you're just using our phone, torchlight.
You're using the torchlight of your phone to take the deliveries.
Yeah.
What if there's bleeding? How do you know where it's bleeding? Have you seen the problem that we're facing in this country? That is the electricity that is powering this entire hospital. If your leader is not serious about the primary healthcare center, they are wasting their time. Because the primary healthcare center is the first level of healthcare in any country, any state, any local government that is serious about healthcare. This hospital does not even have adequate solar care. There's no lights. There are women who give birth in this hospital. You can see what the labor room looks like. There are people who are going to need wound care. You can see what the wards look like. There are children who require help from this hospital. You can see what the resources look like. Vaccines have to be imported from another hospital just so that they can be given to the people here. But no worries.
Unfortunately, the same Nigerian syndrome we have. Instead of fighting the problem, we go for GoFundMe. Instead of addressing the issue, we go for GoFundMe. We cannot GoFundMe the problem away. We can never GoFund the problem away. We need to take it by the horn, take the bull by the horn and fight this corruption in Nigeria. Let me know what you think we can do to remedy our healthcare system. The Minister of Health said people from everywhere is coming to Nigeria. The kind of propaganda and the lies, we need to tell ourselves the truth as a country. It's not just telling people to project the country very, very well. When you are stealing money, you are telling people to project the country very well. If you use the money and the money for the country, money for healthcare well, we wouldn't be projecting the country badly or saying something bad about the country. Everybody loves Nigeria. Thank you for watching. Remember to subscribe, to share, and to comment. Thank you.